Marlo Free is a community health worker with the Great Plains Healthy Start program on the Standing Rock Reservation in North and South Dakota. In addition to this, she is a certified Indigenous breastfeeding counselor who promotes breastfeeding as a part of culture. So with that, I'll hand it over to Marlo, and good luck.
Thank you. Good afternoon, everyone. I'm so happy that you're attending this webinar, breastfeeding. It is good medicine. Next. Reclaiming breastfeeding in Indigenous culture, the original traditional way of feeding baby. It is your choice, sacred responsibility. And we know that feeding your baby is one of the most important decisions that you will make during your pregnancy. The safest and healthiest choice for most women. Remembering to take care of our nation, our sacred responsibilities. Remembering that we do not own our children. Children should be placed in the center of our nation. Rebuilding our nation, and remembering our children have wisdom. You know, the old adage that out of the mouths of babes, so to speak. Next. Benefits to mom. Physical benefits. Speeds recovery after pregnancy. Nutritional benefits. Preventive against some cancers. Emotional benefits. Empowering. You bond with baby. Helps regulate hormones. Breastfeeding helps mom get back into shape faster. Moms who breastfeed recover from childbirth quicker because oxytocin causes the uterus to contract and helps it return to its normal size. Mom makes healthier nutrition choices for herself, knowing she passes these down to baby. And breastfeeding burns about 500 calories a day. Breastfeeding may protect against some cancers in women. Breast, uterine, ovarian, endometrial. And emotionally, moms know they are providing the best for their baby. You as a mother are providing something no one else can provide. Breastfeeding may help a teen mother feel that sense of maturity and establish her as the mother of the baby. Special bonding for mom and baby. It can help mother feel connected to her baby. Baby feels your warmth and hears your heartbeat. And it helps the mothers regulate their hormones after pregnancy. Next. Benefits for baby. Physical. Nutritionally superior, easily digested, boosts immune system, reduces disease risk. Emotionally, bonding with mother, the skin-to-skin contact, and baby's held more. Breast milk is easy to digest because the protein in the human milk is better utilized by a human newborn. Breast milk has protective factors that may prevent diarrhea in infants. Breast milk may protect against necrotizing enterocolitis, NEC, in premature infants. And there's fewer respiratory colds and ear infections. There's been over 100 nutrients identified in breast milk. May decrease the incidence of jaundice, protects against allergies, protective factors against several intestinal, respiratory, and skin infections. Receives intestinal tract protection, protects from juvenile rheumatoid arthritis, protects against infections, common viruses, decreased risk of obesity, helps prevent tooth decay, helps protect from diabetes, some childhood cancers, and protects from Hodgkin's disease. The emotional benefits is breastfeeding helps baby bond with mom by that skin-to-skin nurturing. Breastfeeding provides the love, nourishment, and security. And breastfed babies develop a special closeness and emotional bond to their moms. Next. Reducing disparities. American Indian infants experience a higher rate of hospitalization due to respiratory illnesses. Breastfeeding may reduce this disparity. Among generally healthy infants in developed nations, more than a tripling in severe respiratory tract illnesses resulting in hospitalizations was noted for infants who were not breastfed compared with those who were exclusively breastfed for 4 months. Next. Role of fathers. What can daddy do to support the mom? Provide skin-to-skin contact, provide visual stimuli, interact with baby by talking or singing, quiet time, and spend time with new baby. Babies need skin contact. You can touch and snuggle, you can change and bathe your baby. Baby will love to lay on your chest and listen to your heartbeat. You can dance slowly with baby while holding him or her safely in your arms. And these are for dad. Babies need visual stimuli, so baby can be held close to your face so he or she can look into your eyes. Let baby look over your shoulder and see the world. Talk to baby and tell him or her how your day went. Babies need interaction. When you hold baby, make the same sound he or she makes. Talk to your baby, sing to your baby, read to your baby. Babies need quiet times. When baby does not react well to stimuli, take him or her to a quiet place and just hold him or her closely. Spending time with older children. Sometimes when there's a new baby, mom has to try to find time to spend with the older children because they may miss the way it was before the arrival of the new baby. Next. Fathers supporting mothers. Breastfeeding is natural. Breasts are made for breastfeeding. We see babies with bottles all the time. It's what we're used to seeing. Breasts are often seen as sex objects. Breasts and sex, the two seem to go together, but breasts are made for breastfeeding. Next. Prams, South Dakota, ever breastfed. 6.2% of South Dakota American Indian mothers in South Dakota breastfed or pumped breast milk. You can see in the blue box there. Next. North Dakota ever breastfed. 69.9% of American Indian mothers in South Dakota breastfed or pumped breast milk. Next. South Dakota breastfed less than 2 months. Only 55.8% of South Dakota American Indian mothers breastfed or pumped breast milk for at least 2 months. Next. North Dakota breastfed for 2 months. Only 51.3% of North Dakota American Indian mothers breastfed or pumped breast milk for 2 months, as you can see in the blue box there. And next. Reasons women stopped breastfeeding. Mother had other reason for stopping, 27.8%. My baby had difficulty latching or nursing, 31.3%. Breast milk alone did not satisfy my baby, 27.3%. And I thought I was not producing enough milk or my milk dried up, 56.8%. And 59.1% of South Dakota women who stopped breastfeeding because they thought they were not producing enough milk or their milk dried up. Next. Other reasons women stopped breastfeeding. Nipples were sore, cracked, or bleeding, or it was too painful. My baby had difficulty latching or nursing. And breast milk alone did not satisfy my baby. And I thought I was not producing enough milk or my milk dried up. 59.1% of South Dakota women who stopped breastfeeding because they thought they were not producing enough milk or their milk dried up. Next. Challenges and solutions to breastfeeding. Needing to return to work. That fear, is there enough milk? Latching trouble, sore nipples, lack of support of providers, community, and family. Newborns typically feed around 10 to 12 times a day. This is not a sign of baby not having enough milk. Excessive blood loss, more than 500 milliliters or 17.6 fluid ounces during the birth, or retained fragments of the placenta can delay your milk coming in, which usually happens around 3 days after the birth. A history of polycystic ovarian syndrome, diabetes, thyroid, or other hormonal disorders. Moms with these conditions sometimes experience a low milk supply. Next. Solutions: returning to work, right to breaks, right to pump at work, right to have a private area to pump, and right to be able to store breast milk. The Fair Labor Standards Act of 1938 was used to require an employer to provide reasonable break time for an employee to express breast milk for her nursing child for 1 year after the child's birth, each time such employee has need to express milk. The employer is not required to compensate an employee receiving reasonable break time for any work time spent for such purpose. The employer must also provide a place other than a bathroom for the employee to express breast milk. If these requirements impose undue hardship, an employer that employs fewer than 50 employees is not subject to these requirements. The federal requirements shall not preempt a state law that provides greater protection to employees. And for North Dakota and South Dakota, there are no state laws that provide, that says you have to allow this. Next. Solutions: is there enough milk? A newborn's tummy is, at 1 day old, the size of a marble. It just holds just 1 1/2 teaspoon. By 3 days old, it's the size of a shooter marble, holds about 3/4 to 1 ounce. And at 1 week old, the size of a ping pong ball, which holds about 1 1/2 to 2 ounces of milk. On day 1, your first milk is colostrum. It is yellow and thick and protects your baby. You will have a very small amount, but that's all baby needs. Allow at least 20 minutes or longer each time you feed your baby. By day 3 or 4, your breast will make mature milk, which is thinner and whiter. Small, frequent feedings make sure your baby gets all the milk baby needs. After the first week, baby's stomach still cannot hold much milk. Remember, babies digest breast milk fast. Feeding often will make sure baby is getting enough. It also helps build the milk supply. As baby's tummy keeps growing, small, frequent feedings are best. Let baby lead the way. Breastfeed as often as much as baby wants. This way you will make the perfect amount for your growing baby. Next. Solutions: latching troubles. Latching means your baby attaches to the breast. A good latch allows baby to get enough milk and feed easily without causing nipple pain. There are several ways to hold your baby to get a good hold or latch. Sitting up to breastfeed, sit upright with pillows on your side to support your arms. Use one arm to support baby with your hand behind his neck and shoulders, not his head. Use your other hand to tilt your nipples toward your baby's nose, keeping your fingers away from the areola, the dark area. Get baby to open his mouth very wide. Do this by running your nipple along the little indent from his nose to his upper lip. There are several other types of holds. There's the lying back hold, the side lying hold, the cradle hold, and the football hold. Next. Solutions, sore nipples. Nipple cream, cool compresses, adjusting your hold, wearing a supportive bra, and getting help early. There are many solutions to sore nipples. First, find the problem. Is it a latch problem, a medical problem such as thrush or tongue tie? These need to be treated by a doctor. Then find your solution to your specific problem. Tongue tie is often diagnosed when children have issues with breastfeeding and sucking. Children with tongue tie might slip off the breast or have difficulty latching on. They might make clicking noises and break suction during breastfeeding. Next. While breastfeeding, what should I eat? A woman's breast milk is formulated for her specifically as an individual in her own body. How much should she eat and what kind of foods? It is recommended that nursing mothers increase their caloric intake by 500 calories a day. It's important to maintain a healthy, well-balanced diet to make sure that you have enough energy for your new baby and to protect your health. A visit with a nutritionist or doctor is recommended. Next. While breastfeeding, what shouldn't I eat? You shouldn't eat any raw fish or meats due to possible parasites or bacterial contamination. Alcohol, strong spices or flavors, chocolate, and coffee or tea. Next. What is mastitis and how do I know if I have it? Mastitis is an infection of one or both of the breasts. It can be caused by retaining milk in the breast at the end of a feeding, or it can be caused by germs entering through cracks in the nipple. If you have mastitis, your breast will be extremely sore and hard. It will be red, swollen, and hot. You might even have chills and a fever. And you need to see the doctor for this. Next. What are plugged ducts? And how do I know if I have plugged ducts? And what should I do? If you have plugged ducts, you will notice a small, red, tender lump on your breast. Empty your breasts at each feeding. If baby can't do this, then do it manually or with a pump. Wear a comfortable bra that keeps pressure off any one part of your breast. Change your nursing positions and wipe excess milk from your nipple after feeding. Next. Are medications safe to take while breastfeeding? Few medications are contraindicated while breastfeeding. Physicians should make case-by-case assessments to determine whether a woman's environmental exposure, her own medical condition, or the medical condition of the infant warrants her to interrupt, stop, or never start breastfeeding. If mother is using an illicit street drug, such as PCP or cocaine, it is recommended that the mother go into the narcotic-dependent mothers who are enrolled in a supervised methadone program and have a negative screening for HIV infection and other illicit drugs, then they can breastfeed. Next. Your rights. It is your right to make your own choice about how you are going to feed your infant. It is your right to keep your baby with you after birth and to begin breastfeeding within 1 hour after birth. It is your right to breastfeed anytime, day or night. It is your right to decline bottle feeding and pacifiers. Next. It is your right to have a sign placed on baby's crib saying breastfeeding only. It is your right to know if you are being given any drugs that may dry up your milk, and your right to refuse any of these drugs. It is your right to have a trained professional help assist you with breastfeeding. It is your right to breastfeed in any public or private location where you are allowed to be. Next. Breastfeeding, what you should know. Drugs into breastfeeding, importance of colostrum, when to ask for help, importance of support, and help is available. Next. Important resources. WIC, Women, Infants, and Children. Hospitals or birthing centers. We use midwives, doctors, nurses. The Office on Women's Health Helpline, OWH Helpline, 800 number. Peer supporter or counselors. Breastfeeding counselors, lactation consultants. La Leche League, which our website is, their website is there. And Healthy Start, Indigenous breastfeeding counselors. And Indigenous breastfeeding counselors, such as myself, work specifically with Indigenous mothers and are knowledgeable about their customs and culture. So that's a big focus there. The WIC, everyone's kind of familiar with WIC, being a supplement. They supplement foods, healthcare referrals, and nutrition education for low-income pregnant, breastfeeding, and non-breastfeeding postpartum women, and to infants and children up to age 5 who are found to be at nutritional risk. Most hospitals and birthing centers, most hospitals that deliver babies have certified lactation counselors who offer breastfeeding classes and support for free. The Office on Women's Health Helpline is staffed with breastfeeding peer counselors who can answer your breastfeeding questions in English or Spanish, support you through breastfeeding challenges, and connect you with other resources to help if needed. Peer supporter or counselors. These are mothers who breastfed their babies and are trained to help with everyday problems. They can tell you whether your baby is well latched on and taking in enough milk. If your baby isn't latching well, they'll be able to help you find a better way to position him. If they spot a problem they can't help with, they will be able to refer you to someone who can. And breastfeeding counselors, such as La Leche League leaders, have a deeper level of knowledge and can help with many of the trickier problems, such as baby who isn't gaining sufficient weight or who is refusing to latch. Lactation consultants is needed for more complex problems, such as diagnosing low milk supply and helping moms with premature babies. And next. And thank you. And if we have any questions or comments, we appreciate hearing those.
Marlo, Linda Littlefield asked on the chat, can you talk about the items on the previous slide? What kinds of things are passed in breast milk?
I'm sorry, can you say that again?
Linda asked, Littlefield asked, can you talk about the items on the previous slide? And she said, the second to last slide, what kinds of things are passed in breast milk?
Drugs into breastfeeding, okay. Like alcohol, excuse me, alcohol can be passed into breast milk. Any number of medications can be passed into breast milk. Most of them doing no harm, but that's all for a doctor to determine, depending on the medication and illness. Of course, the importance of colostrum. We know how important that is the first feedings for baby, to get those what do you call them, antigens and the person should really speak with their doctor about those drugs that could possibly go into the breast while breastfeeding. We don't know that specifically, so having a visit with their doctor the doctor would be able to determine if that would do any harm, or can they change the medication, or if, do they have to stop breastfeeding, or any of those things.
Awesome. We have a couple more questions here. Carlos said, do some of the tribal communities have workplace rights for breastfeeding moms? Yeah.
And
do you expand on that, Marlo?
Some do. I believe Standing Rock at this point is working on something like that, but as far as I know right now, there isn't really anything set into place, and I couldn't speak for any of the other reservations.
I will just mention that I think we might see some of that coming with our new grants, possibly. We've been looking over some applications with some of this in it, so.
That'd be great. Mom usually knows when she's making enough milk, if baby is growing like he or she's supposed to. If they're losing weight instead of gaining weight, there might be something going on there, and that's something she should check with her doctor on. Feeding twins or triplets, that is going to be very tricky, but with one child on one side and one on the other, I would say, and then switch off, and they just have to take turns.
Marlo, are you seeing that question from Carla?
Yeah, I'm seeing, from Brenna. People have to talk about it and be educated about breastfeeding, knowing that this is, absolutely the most natural thing in the world. Yeah, there are a lot of stigmatisms out there about breastfeeding, and it does make some people nervous. But I feel like if they're educated and you can educate them, give them some knowledge about it, they would probably feel the same way.
All right, so I'm just going to read those questions so that everybody hears the connections, I guess. Terry wrote, have any tips on how to feed twins or triplets? Marla, do you want to offer anything there?
Yes. My suggestion was they would just have to take turns and alternate, the babies. And I know it'd be quite time consuming, and I don't believe they would really have to be concerned about, making enough breast milk, as long as they're breastfeeding consistently, or if they're going back to work, pumping, so baby has the right amount of milk that they need.
Awesome. Okay. Carlos said your slide that mentioned the size of a baby's tummy early on and the need for frequent breastfeedings. How do we get these two key points across so moms understand that they are usually producing sufficient milk?
Visually, if we can offer something that the mom can see, that, oh yeah, baby's stomach at this point is only the size of a marble, and my colostrum produces, this much, that fills baby up, and then, just proceed with the growth of baby's tummy. But the visual, I believe, would really get the point across.
That's a great idea. So, okay. I think I've addressed most of these questions. Yeah. All right, Marlo, any final thoughts you want to share?
Just that I believe, we really need to promote and educate everyone. There are some good stories out there, of people breastfeeding, and some people, you know, they don't like it, but after they've been educated, told something about it, and they think about, the origin, that's how we were all at one point fed, was breastfeeding.
Awesome.
Thank you.
Thank you.
That
So,
is, I'm sorry, go ahead.
oh, did you want something else?
No, I just, wanted to thank everyone for their questions, and hopefully they'll all help in educating everyone on breastfeeding.
Yay. There's an evaluation link in the chat box. We will be emailing that out as well with a link to the recording. I just want to plug, well, first of all, thank you to Marlo for preparing this and presenting on this topic, much needed. And I do want to announce our next webinar. 2020 is not too far away, 1 p.m. Wednesday, January 8th. With it being Cervical Cancer Awareness Month, we are hosting Honor Programs Patient Navigator Dawn Arkinson. She'll be speaking on cervical cancer basics, and we'll be getting a flyer and an email invite coming very shortly. So thank you everyone for joining us, and have a great rest of the season.
Thank you.